Ladies and gentlemen, my name's Jing Zhang. I'm from Beijing, China. My affiliate is the Department of Interventional Ultrasound, the first medical center China, Chinese PLA General Hospital. The title of my presentation is Pregnancy and Prognosis of a patient with after microwave ablation of uterine fibroids. We know in the last 20 years, the treatment of uterine fibroids changed a lot. From the big trauma hysterectomy to percutaneous microwave ablation. The percutaneous microablation is minimally invasive. This method was used in China in 2007 to treatment the patients with symptomatic uterine fibroids. This method is an ultrasound guidance. One or two microwave needles were inserted into the fibroid by percutaneous or by transvaginal puncture. The microwave energy was released and the tumor was coagulated. The thermal field diffused was monitored in real time by ultrasound. Microwave emission was stopped when the thermal field covered the whole tumor, and then the intravenous contrast ultrasound and enhanced MRI were used to assess the extent of tumor necrosis. This is a procedure of treatment. We can see the thermal needle insert into the fibroid and ultrasound guidance, and then the microwave energy was released. We can see the power from the center to the match of the tumor. When the thermal field covered the whole tumor, the treatment was stopped. And then the contrast-enhanced ultrasound was used to assess the necrosis. We can see the hollow is the tumor necrosis. After treatment, we can see only have a very, very tiny hole in the abdomen skin. And this method can use the different type of uterine fibroid from 0 to 6 types. And this is a 0 fibroid. This is a before treatment, and this is after treatment. The tumor necrosed completely. And 6 days after treatment, the whole tumor excited vaginally. And this is type 3 fibroids. This is a before, and this is after. This is a tumor in the uterus, and this is after treatment. The tumor necrosed. After the tumor transferred from vaginal, the body of the uterus recovered to normal, and this is a different tumor. This is a before, this is a after. This is 6 months after ablation. The uterus recovered to normal. And this method can be used to multiple tumor. This is a before treatment. We can see 1, 2, 3, 4 tumors in the uterus, and this is after treatment. This is tape 3, fibroids at the post wall of uterus. This is before treatment, and this with the hollow is after treatment, the tumor necrosis. This is 5 months later treatment, the tumor shrink significantly. And this is a patient's age 28. The patients with a big and multiple fibroid, the length of uterus is 22 centimeters. This is before treatment. We can see multiple tumor. And this is 3 days after treatment. The body of uterus and the tumor shrink significantly. And this is 3 months after microwave ablation. This is a 1 year later treatment. And this is before ablation. We can see the abdomen, the lower abdomen, and this is 3 months after treatment. This 1 year after treatment. We can see the lower abdomen is flat. In the period of treatment, we noted that some patients unintended pregnancy and have a good prognosis. That suggests that the microwave ablation maybe can improve the patient fertility. So the study was designed to explore the pregnancy and its prognosis of patients with fibroids after microwave ablation and the influence effects that affect pregnancy was analyzed. The study was prospective. The patients were treated by microwave ablation and ultrasound guidance by percutaneous or transvaginal puncture from August 2010 to September 2020. The fertility desire was interviewed at 3, 6, 9, 12, and 24 months after treatment to assess the patient's pregnancy and its outcomes. Analysis of successful pregnancy patients were conducted, and its facts that affecting pregnancy after microablation were analyzed. For the patients who are married, a hysterogram catheter was inserted into the uterine cavity to protect endometrium in the period of ablation. And the sterile saline was injected into the uterine cavity during the ablation. Here is sterile saline. Results. After treatment, 604 patients underwent the treatment. Among them, 438 no need fertility was excluded the analysis, and another 12 the patients loss of the follow-up were excluded. So the follow-up success, the number of patients was 154. Among them, excluded 73 because some are marriage and some contraceptions, and because another facts number is 19. So involving the analyzed the patients was 81. Among the 81 patients, that the follow-up time was 1 to 104 months. Among them, the total 45 patients with a 50 pregnancy. The pregnancy rate was 55.5. The median conception time was 18 months. Natural and artificial assisted pregnancy rate were 48.1 and 70.4% respectively. The number of pregnancies that ended in spontaneous were 11 cases. The number of introduced abortion were 9 cases. 24 pregnancy result in deliveries. Among them, one of the patients have 2 deliveries. The total 76% of gravity were performed cesarean section, and 24 adapted for vaginal delivery. All the 25 newborns survived and were in good health at the end of the follow-up. Only one case had placenta rupture at 26 weeks gestation, while the other had no severe complications during the prenatal period. This is the facts that affect the pregnancy rate. The patient's age, this history of spontaneous abortion, and the classification of fibroids are different. For the uterine fibroids patients with fertility requirements, the patient's age, the history of spontaneous abortion, and fibroid types are related facts affecting pregnancy after microwave ablation. The spontaneous abortion rate were 22% for the patients who age less than 35 years old, and 23.3% for the patients who age was larger than 35 years old. Pregnancy rate after microwave ablation for subserosa and intramural fibroid were higher than that submucosa fibroids. This is a case the patients 24 years old with endovascular gliomas. This is before microablation. The main tumor is located on the posterior wall of uterus. The patient was diagnosed primary infertility because she no pregnancy for 3 years after marriage. This is 3 months after microablation. The fibroids shrink significantly. 12 months after microwave ablation, the patient got pregnancy, and 10 months later, 4,200 grams of healthy boy baby were born. This is a patient 30 years old with grade 2 fibroids. This is MRI of a before microwave ablation. This is 3 days after microablation. The tumor shrinks significantly and the tumor necroses completely. And this is 24 months after ablation. We can see the tumor shrink to original less than 20%, and the body of uterus almost recovered to normal. Conclusions: ultrasound-guided microwave ablation for uterine fibroid is convenient and minimally invasive and safe treatment. Microwave ablation could be considered a promising treatment for patients with symptomatic uterine fibroids and need fertility. Thank you for your attention.